Welcome to the Autism Alliance of Michigan Skill Building Series. Autism Alliance of Michigan is guided by the vision that people with autism will lead lives that meet their greatest potential. The mission of Autism Alliance of Michigan is to lead efforts to raise expectations and expand opportunities for people touched by autism across the lifespan. Hi, and my name is Stacy Holland. I'm a physical therapist consultant for Autism Alliance of Michigan, and welcome to our webinar today on walking. Please look for the corresponding handout, and please feel free to print it and use it to follow along with this webinar to take notes if any information stands out as relatable to your child's journey. Today's agenda for walking will go through the following areas of discussion. These areas consist in the most commonly seen developmental progressions, challenges sometimes faced or seen with walking, as well as suggestions to assist with aiding and challenging a child. Please note that not all children develop through each of these postures equally. These are just suggestions of postures and activities to look at and perform. Please always keep your child's safety in mind, and if challenging a new posture or position, please use safety precautions to keep your child safe and prevent injury or harm. Our progression starts with the factors that are the skills seen with support around the trunk or at the hands. Walking actually starts as young as 1 to 2 months with head support. Your child will appear to be moving their body as if they're taking steps. This is actually a stepping reflex, our primitive reflex, and this will integrate by 6 weeks of age. So as the child develops and gets stronger with enough cervical and trunk strength, you'll begin to find that the child will start to bounce in place while standing. The bouncing will begin to transition into more of a unilateral or side-to-side movement, looking like stomping of the feet. They may or may not move their body forward with the stomping. Then once coordination improves in this posture, they will attempt to step. This includes cruising laterally or side to side against a tall surface, walking with 2 hands or 1 handhold, as well as walking with a push toy. So next we're going to look at the development without any support. First, we'll see an immature gait. This is when a child first starts to walk. They'll have flat feet, a really wide base of support. Their feet are far away from each other. Their legs will look really stiff. Their trunk will look really stiff, and their arms will be up in the air in what we call a high guard position. This independent walking will occur around 12 to 18 months of age. As their balance improves and coordination of that transition of weight shifting occurs, a child will demonstrate a heel-to-toe walk. This normally occurs after about 2 years of walking, so about 3 years of age. Then, around 7 years of age, the child will demonstrate pelvic and shoulder rotation in opposition, as well as an arm swing resembling adult gait. Some of the challenges that are sometimes seen with walking, so the first one is clumsiness. Research has shown that those with autism can have slower reaction times along with decreased body awareness or that proprioception. This could actually create a sustained amount of clumsiness with walking. Walking requires, moving on to the next tagline, the toe walking. Walking does require at least a neutral ankle for toe clearance, but ideally 10 to 15 degrees for proper gait mechanics. A forward body with increased hip flexion, which research hypothesizes to be a compensation to assist in toe clearance, as well as reduced toe off forces, appear to be most prevalent in the research. And when I say toe off forces, so if you think about your foot that's on the ground, as your body's moving forward, getting ready to step down on the foot that's in the air, if you think about where your heel and your foot are, just as your body's shifting over to the opposite side, your heel starts to come up off the floor, and you have a little bit of push off of your toes to kind of push your body forward. And more research is needed to see if those with autism actually have decreased joint mobility or if it's actually increased joint rigidity with gait. So when looking at their range, if it's overall is reduced, or if those with autism actually are trying to make their ankles more rigid, with walking due to either possible sensory defensiveness, poor weight distribution forward, or a lower tone in the ankles. It could be a compensation, which would create toe walking. This decision often needs a team of professionals to assist in assessing. Our next strip, to the reduced step length, increased step width. Research shows that a reduced step length along with increased step width, this seems to go with the research noting the larger fluctuations in their center of gravity, as if it's a possible way of increasing some stability with their gait. So they're taking a smaller step because if they're moving their body side to side in a larger movement, if they take a larger step with that, that could actually kind of snowball into that clumsiness that we see. So they might actually be trying to catch themselves with their walking. And with the increased step width, they're probably trying to counteract that large fluctuation that they tend to have. And our last strip is difficulty with multitasking. We also see that there can be difficulty with multitasking with walking, such as more difficulty walking and turning head, or doing a cognitive task. This may slow walking speed down. The research does show mixed results on this and may actually vary on the child's age and cognitive level. So activities that are listed here are to work on improving walking. First is monitoring ankle range of motion. So wanting to make sure the toes in that midfoot are able to move past that neutral position, which is about 10 to 15 degrees. Again, is ideal. Here's an easy way to assess this. You would have your child lay on their belly with their feet hanging off of either a bed or a couch, whatever they're laying on, with their knees straight. You'd want to hold the foot and heel and then move the foot, so the toes and the midfoot, the top of that foot, up towards the shin slowly until you begin to feel some resistance. And then continuing to hold and support that foot, attempt to see if you can move it a little bit more after you've held it to see if the muscles relax a little bit more. So moving on to our next point is playing on the belly. Again, that belly play, or in the clinic we call it prone work, especially when on hands when the child's older, will increase trunk strength, aiding in posture and weight shifting. This plank position can also be done with the child's stomach on an exercise ball, end of the couch, or in a 4-point position, so on hands and knees. If plank position, just as a reminder, know that the more of the body that is supported, the easier this posture will be. The less that the body is supported, so whatever's hanging off of the, we'll say, bed in this example, whatever's hanging off the bed, the longer, the more of the body's hanging off the bed, the harder, more challenging that posture will be for the child. Next, we'll be looking at walking with pushing and pulling objects that have some sort of resistance. Doing this will actually have the child bear down into the floor and having to push off the ground. This forces the child to increase body awareness and utilizes more control to propel that object, providing the resistance. This could also be a good training tool to really get a good push off with the toe, as we had mentioned in the last slide. Next, we'll be looking at a weighted vest or backpack for feedback to the heel. So much like in our standing section we were talking about, this can help increase proprioceptive feedback or improve trunk positioning over the ankle bone with walking. Again, no more than 10% of the child's body weight is needed for this type of feedback. And then lastly, working on walking on narrow surfaces to challenge riding reaction, coordination, and improve their step width during gait. So if they're able to walk in a narrow surface, hopefully that will translate over and decrease that step width that they have. So that finishes up our mini webinar on walking. For any additional information, questions, and resources, please contact Autism Alliance of Michigan. AAOM is prepared at no cost to counsel, advocate, and connect families to evidence-based care and support however long it takes. Our navigation program will connect anyone touched by autism to a free lifelong guide with professional help and answers. Thank you very much for attending our webinar.